Hi, good afternoon.
Good afternoon.
My name is Bobby.
Nice to meet you, Bobby.
What is your name?
Chelsea.
Chelsea. And what brought you in today?
Well, I haven't had my period in about 4 weeks.
Okay. So I'm a nurse practitioner student at St. Anthony College of Nursing. Do you know what nurse practitioner is?
No, I don't.
Okay, so nurse practitioner is basically who has an advanced degree in nursing. This could be either at the doctorate level or could be at the master level. Nurse practitioner, once they graduate, they do practice in various different areas. They see the patient just like all medical doctors sees. They manage the patients, they manage their medications. Alrighty, so Chelsea, what is your date of birth?
1/14/85.
Alrighty, so you said that you are having some irregular period or missed period?
Missed period.
Missed period. How long?
February 1st was around my last period. It's been about 4 weeks.
4 weeks. Alrighty. So have you ever had any missed period before?
I have, but not this long.
Okay.
My periods are irregular sometimes, but not for this long.
So what, may I ask you, like, what is your normal, like, how many days of the, usually you get period, like every 30 days or even longer, or
Maybe between 30 and 40 days.
between 30 and 40 days? Has ever passed, like, past 60 days or anything like that?
No.
Now, this irregular period, is it something new or it has been like always since long time, or?
It's always been that way.
Okay, so what was your, like, when did you have your first period?
About 14.
At age of 14? So I understood correct that since age of 14 you always had like irregular period, and your cycle could be anywhere from 30 to 40 days, but never past 60 days.
Right.
Okay, alright. So when did you started noticing like body changes when you were young first? Like increasing your breast size or like some pubic hair, underarm hair, kind of a, you know, like how from the child to adolescent. When did you notice those body change? Do you remember?
Probably when I was 12.
12. Okay. So what is your normal, like when you get like every 30 to 40 days your period, is it like, do you consider as like a heavy flow? What type of the flow do you get?
It's a heavy first 2 days and then it kind of tapers off a little bit.
Okay.
Probably 6 to 8 pads a day on the first 2 days.
Okay, so now how often do you change your pad or a tampon? Do you wear pad or a tampon?
Both.
Both. So how often do you change, like in the first few days when you consider your heavy flow?
Probably about 6 to 8 pads a day and
So
about 6 to 8 tampons a day too.
So I take it like every 4 hours, probably
Yeah,
you have to change it.
3 to 4 hours, yes.
3 to 4 hours, okay.
Sometimes more frequent.
Okay, so now, do you have like any vaginal discharge, dryness, any odor?
No.
Do you have like any spotting right now?
No.
Any cramping?
No.
How about like any itching, vaginal itching or irritations?
No.
You don't have that, any of those? Do you feel like any like hot flashes or like any recent sleep disturbance?
It is difficult to sleep, but no hot
Difficulty in
flashes.
sleep? Is it something new, or how long you been noticing the sleep disturbance?
Just over the last month.
Last month, so about like 4 weeks.
Mm-hmm.
How about any changes in your mood?
Just no.
No.
Just tired.
No change. Oh, you feel tired?
Mm-hmm.
And this has been going on since 4 weeks as well?
Yes.
Okay. Alright. How about, do you have any like a dizziness, any headache? Do you have like any visual disturbance?
No.
Any vomiting?
Yes.
You are having some vomiting?
Yep.
Okay. Okay. And how about any nausea?
Yes.
Okay. How long this vomiting has been going on?
Just a couple weeks.
Couple weeks. Is it like you consider as a lot of vomitings where you really need to worry about feeling dehydrated, or it's just like a little bit?
It's just a little bit.
Now does the vomiting comes like after eating, or it just randomly comes?
Randomly comes.
Randomly comes. And if you describe your vomit, it's like a large amount of the vomit, or just like a couple ounces, or
Maybe about a cup.
cup? Okay. And it's just whatever you eating, or something different, like any color, any bright
Yeah.
red blood, nothing
No,
like that?
no blood.
Okay. And nausea is like a constant, or it kind of comes and goes as well?
Comes and goes.
Comes and goes. Do you notice any like a swelling on your body, in your arm, or in lower extremities, or anything like that?
No.
Okay. Alrighty. And do you have been noticing any like a frequency, urgency, or like an increased urination?
I feel like I have to, when I have to go, I have to go.
You have to go. This is always like this, or this is something new?
This is new.
New.
Within the last couple weeks.
Last couple of weeks. Okay. So with this, do you think you recently have like a kind of either weight loss or weight gain? Or you've been kind of steady?
I haven't noticed anything.
No. Now, do you fluctuate your weight, or you kind of stay steady?
I stay steady.
Stay steady. Okay. Alrighty. So, do you do any exercise?
Not regularly.
Not regularly. Okay. How about, are you on any special diet, or just the regular diet?
No, just regular.
Since your nausea and vomiting, has anything changed in your diet, or pretty much you can tolerate everything?
I can tolerate.
Tolerate everything?
Mhm.
Okay. Alrighty. The reason I ask for exercise, because sometime you said that you have this irregular missed kind of a period. That can happen with over exercise as well. It could also be like fall into like some your hypothalamic or pituitary changes in your body could also cause, so that's why I wanted to make sure. So now my next question is like, do you see any like feeling unusual hot or cold, or feeling more thirsty or hungry, something like that?
No.
Or has been recently diagnosed with diabetes or
No.
anything?
No.
Alrighty.
My breasts are sore though too.
Oh, so that was my next question.
Okay.
Have you seen any changes in your hair, or in a skin, dry skin, or anything like that?
No, those are.
So you talking about changes in your breast. Can you tell me what is going on with your breast?
They just feel more tender to touch.
More tender. This is something new.
Yeah, in the last couple of weeks.
Okay, so you do have some breast tenderness going on in the last couple of weeks. Okay. Alrighty. So my next question is, are you married?
Yes.
Okay. Alrighty. So what do you do?
I am a student, nursing student, and I work in a nursing home.
Oh, you work in a nursing home. Okay. So I take it you are sexually active?
Yes.
Okay. Alrighty. And is it a male partner or female partner?
Male partner.
Okay. So my next question is a little bit sensitive, and I have to inquire because that will help me put you for a correct diagnosis. So my next question is from how many total partner in a lifetime you had?
3.
3. And was it male or female?
Male.
Male. Alrighty. So do you use any contraceptive?
No, just condoms. Most of the time.
Most of the time. So do you use most of the time means regularly, or sometimes?
Sometimes not.
Sometimes not. Now in the past, have you ever tried using oral contraceptive or any Depo-Provera injection, or maybe like a IUD or implanted birth control devices? Nothing like that. Okay. Have you ever been diagnosed with STDs?
No.
Okay. So, have you ever been pregnant in your life?
Yes.
Okay.
Once.
Once. Okay. Any miscarriages?
No.
No. So one pregnancy. Was it how many birth?
One.
One. Any pregnancy complications?
No.
No.
5 and No, I didn't really have any problems other than some sickness when I was pregnant,
Okay, alrighty.
some nausea,
Nausea,
Mhm.
okay,
but other than that, it was a good pregnancy.
okay. And how long ago was that?
5 years ago.
5 years ago, okay, alrighty. When was your last pap smear was done? Do you have regular pap smear done?
Yes, it was done last year.
Last year,
Mhm.
okay. And when was your last physical exam was done?
I think it was last year too, around the same time.
Okay. And now I just want to ask you about your medication allergy. Are you allergic to any medication that
No.
you are aware of it?
No.
How about any environmental allergy or any latex or any food
Mm-mm.
or any iodine or any kind of allergy that you recall?
None that I know of.
Okay. Do you recently take any prescribed medication?
No.
How-
Well, just a multivitamin.
Multivitamin,
Yes.
but nothing prescribed medication?
No.
Okay. And you take just the over-the-counter
Yep.
multivitamin?
Mhm.
Do you take any herbals or any home remedies?
No.
No, okay. So my next question is, when was your last flu shot was?
It was last October.
Last October, so you are up to date.
Yeah.
Have you ever had any HPV vaccine?
Yes, I think around 14.
Okay, all right. And have you ever been like screened for cervical cancer?
Yes, yeah.
So,
I think that was last year as well.
so you should be up to date then?
Yes.
Okay, alrighty.
Mhm.
Any medical condition, any asthma, any heart problems, lungs problems, any skin problems, breathing,
No, I'm pretty healthy.
pretty healthy, no medical problems?
No.
Okay. Have you ever had like off and on any kind of in between nausea or anything? This is just only first time you are happening?
Yeah, just for the last couple weeks.
Okay, you didn't had any upset stomach or constipation problems
No.
or anything like that?
No.
Okay, alrighty. Any surgeries in the past?
No.
No surgeries in the past. Do you drink any alcohol?
Yes. Probably about a glass to 2 glasses of wine a week.
Wine a week. Any beer or any hard liquor or anything?
No.
How long you been drinking?
Probably since I was 20, maybe.
20. And you said about like once or twice a week?
Mhm.
Okay, alrighty. How about any smoking?
No.
No smoking. Any illicit drugs?
No.
No. Okay. How about any caffeine?
Yes. 1 to 2 cups of coffee a day.
1 to 2 cup of coffee. Any other form of a caffeine?
No, not usually.
No. Okay. And now, speaking of your wine, have you ever drink wine during your first pregnancy?
No.
No. Okay. So you just did not do that. Okay. Alrighty. Any history of any like abuse?
No.
No, never.
No.
Okay. Any mental illness like
No.
depression, anxiety?
Mm-mm.
No. How about any eating disorder like overeating or not eating or anything like that?
No. Mm-mm.
Do you have any pet in the house, cat or anything?
2 cats and 2 dogs.
2 cats and 2 dogs. Alrighty. Alright, so I just want to find out a little bit more about your family as well. So in your family, your mother, father, or maternal grandparents or paternal grandparents or brothers, sisters, has ever been diagnosed with any medical condition such as like hypertension, diabetes, asthma, any COPDs or any skin problems?
Hypertension for both my parents.
Okay. Do you know what age they were diagnosed with hypertension?
Probably in their late 40s, early 50s.
Late 40 to 50? Okay. And other than that, everybody else in our family is pretty good?
Mm-hmm.
Okay.
Very healthy.
So for your family female history, has anybody ever been diagnosed or had known early menopause?
Well, not that I know of.
Any like polycystic ovarian syndrome?
No.
Any pregnancy complications?
No.
any like menstrual heavy bleeding or cramps or any kind of problems?
Honestly, I wouldn't know.
Uh, do you remember like your mother had like a normal pregnancies or complicated pregnancy, or what age she was first time pregnant?
She was in her 20s.
She was in 20s.
Yeah, but no complications.
No complications, okay. Alrighty. So it looks like I have asked all the questions that I wanted to find out. I do want to assess you a little bit.
Okay.
I do see that the CNA has done the blood pressures and your temperature, respiration, so they are looking pretty normal.
Good.
Also, when you arrive, we ran a urine pregnancy test on you just to make sure. So we'll go that over in a shortly, hopefully by the time the result will be back as well.
Okay.
So at this point, I want to just do the assessment.
Okay.
So first thing, I am going to go ahead and do your general assessment of your skin. I also want to check your hair, and then I'm going to listen to your lung sounds,
Okay.
heart sounds, your tummy sounds. Also, I'm going to check your extremities for any edema or any swellings. Since you had a physical exam last year and you're coming up here, so I want to check your eye, mouth, and nose as well. Any hearing problems?
No.
No. All right. So I'm just checking your hair, and that is looking good. Next, I am going to check your eyes. If you can look at me, I'm just looking your conjunctiva and your sclera, your iris. Keep focusing at me. I'm gonna just look at your eyes, and they are looking pretty good. So I'm gonna go ahead and check your eye first. And if you can just look at me, and I'm shining the light. And you look at me. Just coming closer now. Alrighty. So next I'm going to check your mouth,
Okay.
and also I'm going to check any breathing problems.
No.
No. So I'm just gonna check your nose as well. And no problems. Go ahead and look it up a little bit. Alrighty. And it looks good. No swelling, and it looks pretty good. Next, I'm going to go ahead and have you open your mouth
Okay.
and stick out your tongue for me and say ah, and lift up your head slightly up for me. Good. And looking good. Right. And no problem. Okay. And can you roll your tongue side and lift up a little bit? And other side? Good. So now next is I want to listen your lung sounds.
Okay.
You will feel me touching with my stethoscope.
Okay.
And when you feel me touching, you take a nice deep breath
Okay.
in through your mouth, out through your nose. And while I'm continue checking, if you get tired or lightheaded, you let me know.
Okay.
I do want to assess in the front as well as in the back And my front assessment, that's going to include your heart as well, okay?
Okay.
So I'm going to go ahead and start with back first.
Okay.
Take a nice deep breath. Good. Just a little bit on the side. Good. Now coming in the front, take a nice deep breath. All right, just gonna check your heart. Alrighty. So now I do want to check your abdomen, so I'm gonna have you lay down up here.
Okay.
Alrighty, so I'm just gonna look at first. Alrighty, and then I'm gonna just go ahead and listen your abdomen.
Mhm.
Alrighty, I'm just gonna do a little tapping. Just little touching. Now a little deeper touching.
Okay.
Alrighty, I'm gonna have you get up now. Just wanna, if you can just, I'm gonna just look at your nail, skin, for any good capillary refill, good pulses. Good. And checking your extremities for any swellings.
Mhm.
And looking great. Can you squeeze my hand? Good. And open your arm like this. Good. Good. And you walk, so you have pretty good. Go ahead and relax it. So you don't have any trouble walking.
Mhm.
So I do have a result back.
Okay. Good.
And since you missed your period, last period was February 1st. So we just ran the urine pregnancy test, which is enough to see whether you are pregnant or not.
Mm-hmm.
And the urine pregnancy test result shows that you are pregnant.
Oh,
So,
okay.
how are you feeling about this?
Happy.
Happy.
Mm-hmm.
And you plan to keep this?
Yes.
Good. All right. So now the next plan is that I want to calculate your due date. I'm sure you want to know that.
Yes.
So my calculation is basically since you heard February 1st, so I'm adding 7 days, subtracting 3 months, so October, November. So November 20, it would be November 7th, 2020.
Oh, okay.
Yeah, but we still want to make sure that we do the ultrasound to find out the gestational age.
Mm-hmm.
We do need a lot of lab order just to make sure that you are all doing fine.
Okay.
Meanwhile, I am recommending that you start taking the prenatal vitamins once every day.
Okay.
And you've been doing good with the multivitamins, but we want to switch it to the prenatal vitamins.
Okay.
Now, for exercise, I'm saying that it's absolutely okay to do the exercise. Normal exercise is fine. You can do exercise up to your heart rate is up to 150.
Okay.
Above 150, consider a little strenuous exercise, so you might want to hold off.
Okay.
For a diet wise, you can eat healthy fruits, vegetables. Now, since you are having nausea and vomiting, this is also part of the reason because of the hormonal changes.
Yeah.
So maybe good idea to have like some small meals, frequent meals, some crackers in the morning. That is definitely going to help you.
Okay.
Also, you mentioned about having a pet, especially cat in a house. We recommend during the pregnancy you want to stay away from the cat litter.
Okay.
Also, the summer is approaching, and if you are like a person who likes to work in a garden, then you might want to avoid doing that as well.
Okay.
We don't recommend that you come back see me frequently. 4 to 6 week follow-up is fine.
Okay.
We will order as every time you come, we will continue order new test for you.
Okay.
So right now I'm saying that you can come back in a 4 to 6 weeks, and if you think you need to come see me again, then you can come back again as well.
Okay.
So do you have any question?
No, I don't think so.
Okay, all right, well, it is very nice
Thank you.
meeting
Very
you.
nice to meet you.
You take care, and
You too.
we will have your after visit summary to go home, okay?
Thank you.
Mm-hmm.